Welcome to the Dr. Journal Club podcast, the show that goes under the hood of evidence-based integrative medicine. We review recent research articles, interview evidence-based medicine thought leaders, and discuss the challenges and opportunities of integrating evidence-based and integrative medicine. Continue your learning after the show at www.drjournalclub.com.
Please bear in mind that this is for educational and entertainment purposes only. Talk to your doctor before making any medical decisions, changes, etc. Everything we're talking about, that's to teach you guys stuff and have fun. We are not your doctors. Also, we would love to answer your specific questions. On drjournalclub.com, you can post questions and comments for specific videos, but go ahead and email us directly at josh@drjournalclub.com. That's josh@drjournalclub.com. Send us your listener questions and we will discuss it on our pod. Hello and welcome to the Dr. Journal Club podcast. Today we have a guest with us, Dr. Mark Davis. Hello, sir. How are you doing?
So good. So happy to be here.
So I adore Mark. We go way back. And one of the things I love about you, sir, is I feel like you're always, like, you embody joie de vivre. I have to say that, right? Like, you're just always full of life. And every time I say hi, you're just like in a really great mood. And I mean, I don't know if it's a facade. I don't think it is. It seems authentic. I don't know how someone can be continuously that full of life, but you tell me.
I feel like I was like lucky. I was born happy and it just never wore off.
Nice. Dear listener, Adam has absconded for the day. He claims he has family responsibilities. I have a feeling he's just going to go do a try workout or something. But we will assume the best about him and he will join us again next week. Or he's just really sick of talking about homeopathy, which could also be true. There could be more than one true thing. So this is probably our last homeopathy talk in the series. And Mark, maybe tell us a little bit about yourself first, and then maybe, you know, why you're here, why we're chatting and all that jazz, and then we can jump in.
Okay, great. So I am also a naturopathic doctor. I've been practicing since 2011, and I am a longtime listener, first time guest on the show, and I love listening to it. And when I heard you start this meta wars on homeopathy, I felt like you were describing me as you described yourself.
Yeah.
The skeptic sitting in the back of the naturopathic classroom.
Yeah.
We had 4 required courses in homeopathy, which is like a lot of courses.
Yeah.
And the whole time. So I grew up, a little bit of background. I grew up in a kind of a medical family. My mom is a nurse. She has 3 siblings who are doctors. Their mom and dad were a nurse and a doctor. Their dad's mom and dad were a doctor and a nurse. And so I grew up,
oh, wow.
Our family was all in on conventional medicine. I'd never heard of homeopathy, didn't know it existed until I was in my late teens. And randomly, the suburb next to mine growing up is the largest concentration of this weird religion called Swedenborgianism, I think, in the world, or maybe at least outside of Sweden. And there's a lot of famous Swedenborgianist homeopaths, as I learned in school.
Did not know. Interesting.
Yeah. So anyway, when I met those people, they were like, oh, somebody falls down and skins their knees. Their grandmother gives them arnica. It's like homeopathy is just in the culture of that group of people.
Mm-hmm.
And so that's the first time I ever heard of it. And so then I got to school and I was like, oh, this is the thing the weird Swedenborgianists do. Like, okay, what's this? I was like, and then I heard about this idea that these are substances that, at least in the most common potency, 30C, are diluted beyond Avogadro's number. I was like, this is impossible. So if it's real, it blows everything up. I have to find out if it's real.
Yeah.
So I did the same thing you did. I read the full text of every randomized controlled trial I could find. And when Lint et al. Was published, I read it obsessively. And when Shang et al. Came out, well, I guess actually both of those were published. I guess when I discovered them, I read them obsessively because they were published before I started school.
I think we met talking about Shang, didn't we?
Absolutely. Yeah. Yeah. I remember in Bastyr, our good mutual friends were like, oh, you two have to know each other. And it was true.
The nerds in the back of the class talking about homeopathy meta-analyses. You two need to meet.
Exactly. Yeah. And my dad is a physicist. So in his world, he's like, oh, yeah, statistical significance for like particle physics at the Large Hadron Collider is like 0.000005 or below. So his world of significance is very different. And so I started school. I was like, could this homeopathy thing be real? It can't, right? And so I took all the courses. I read all the papers. I wrote a song.
You did?
Yeah.
You wrote a homeopathy song?
Oh, yeah. Can I sing it for you?
Yeah.
Okay.
How could you not?
Here's how it goes. Homeopathy. They tell you what you get is much more than what you see. Does the science bear it out? I have to ask you when, because science does not have good answers in 2010. It's been controversial from the start, because medicine's a science and an art. Oh, but I wonder, is it the medicine for me? Well, homeopathy.
Oh my gosh, I just love it so much.
Thank you.
Did I not know you had a song?
Yeah, I wrote it in 2010 because I was obsessed. I was like, I have to know. And then someone was like, oh no, you know what you have to do? You have to take the NESH course, New England School of Homeopathy.
You did the NESH course?
Yeah, it was thousands of dollars. I didn't have as a poor student. I borrowed money from my parents to take this course.
Your physicist and Dr. Parents.
That's right. So it's just a nurse. My mom's a nurse, yeah. And they were like, okay. And so, but like 4 or 5 weekends in, I was like, oh, this is not going to convince me of anything. No, it's just more anecdotes. So I never finished the course. And so, I was there doing the same skeptical thing you were doing. And so when you started this series, I was like, oh my God, I've got to know. And so yeah, I sent you a couple trials.
Yeah.
Thanks for reviewing the depression one. Turned out to be nothing. I actually hadn't read it. I felt like a king who had brilliant meta-analysts to read a paper for me and explain that it was sort of nothing. I felt so lucky. And so I'm so excited to have this conversation, because this little meta-analysis is one that I have brought up several times in conversations with friends and family who I talk about homeopathy with. So I'm excited to read it.
Awesome. Well, let's jump in. I want to set a little bit more of the stage on this one that I thought was a nice addition. So maybe we need your dad on the podcast to do the physics stuff. But essentially, like, we started with the meta wars, Lind paper, really well done meta-analysis, pro homeopathy, Shang paper, really good meta-analysis. Maybe it's still placebo. And the end of that was this, these arguments about, well, maybe it was publication bias. We talked about that. Maybe it was small study effects. Talked about that. But one of the things that they ended with was, what would be more convincing is if we had, consistent evidence for a particular condition. That's when we did the depression. And then, which you sent us, thank you.
Mm-hmm.
And then also, if we had like consistent evidence within a single lab, that would be, supportive evidence as well. And then you sent us this one as well, which is exactly that, basically.
Yeah, I think that was Adam's take home from Lind, is there needs to be more reproducibility,
Mm-hmm.
a bunch of studies from ideally a bunch of different labs, but even one lab. And then Shang was published in 2005, but they only looked at the literature up until 2003.
Mm-hmm. Mm-hmm.
And so this meta-analysis we're going to talk about was published in 2003.
Mm-hmm.
The individual clinical trials were all published earlier, and Shang must have looked at them.
I would assume so. Yeah.
But if you remember, they were only looking at the 8 largest trials.
Oh, yeah.
And these weren't large enough.
That's a very interesting approach.
Yeah, their approach is very interesting. I actually want to, if you guys have it in you to do one more episode.
Okay. What do you got?
I'd love to send you some rebuttals that people wrote.
Oh, we should totally do that.
Like Lind wrote a response to Shang.
Oh, okay.
Yeah. And then there was another group that looked at the Shang data and was like, they didn't pre-register why they picked the trial sizes they did. And if you look at the 7 largest trials using their methodology, you get significance. And if you look at the 9 largest trials, you get significance. And it's kind of...
And they did 8.
They did 8.
Yeah, that's interesting. I had the same thought about the registration because the methods were so novel and unique. And there's some control by also doing it for conventional medicine. But yeah, there could be a lot of opportunity for p hacking there without registration. But we should maybe we should do the Lynn paper. Maybe you'll join us again, guest homeopathic appearance.
Great.
For the Lynn rebuttal. Okay, cool. So then this was one of these ideas of, can we like repeat this experiment multiple times in multiple locations and get and what would we see? Do you want to, because you clearly know this stuff super, super well, do you want to walk us through like the basics of the study design, and then we can get into like critique and thoughts and stuff?
Yeah. So the study's called Homeopathy for Childhood Diarrhea, Combined Results and Meta-Analysis from 3 randomized controlled clinical trials, published in Pediatric Infectious Disease Journal in 2003. Let's see, it has an impact factor of 3.2 now, so that's not too bad. And the authors are the primary investigator is Jennifer Jacobs, who was also the primary investigator in each of the clinical trials.
Mm-hmm.
Second author is Wayne Jonas, who was he was the director of NCAM, which is now NCCIH, for a bunch of years, and
which is the NIH's complementary integrated medicine arm.
Yeah, and he teaches medicine he's a medical doctor, teaches at Georgetown near me, and Uniformed Services University of Health Sciences.
High level guy, very, very famous. Yeah,
high level guy, very famous guy. So maybe that's a little bit conflicty that she's the primary investigator on all 3 clinical trials, and not conflict of interesty, but like more potential for bias. So she had done 3 small-ish clinical trials in Nicaragua and also in Nepal.
Mm-hmm.
And in those trials, they found kids suffering from infectious diarrhea, and they gave them all standard of care, which is oral rehydration therapy. And they all had classical homeopathy intakes. And then they took their prescription to a pharmacist who gave them either the homeopathic remedy that was prescribed for them or an identical placebo. It was double-blinded. Only the pharmacist knew who was getting what. And then they were assessed for a bunch of things. The main outcome was resolution of diarrhea,
mm-hmm.
which I think was like 2 consecutive days of formed stools, 2 of only formed stools. Anyway, so the first pilot study, homeopathy's safe, and like I think it was non-significant but trended towards significance. The second one, also in Nicaragua, was larger and significant, if I'm remembering correctly.
Well, just shy thereof. I think it was 0.07. Yeah.
Okay, 0.07. And then the third one in Nepal, that one did hit statistical significance?
I think so, at least for the number of stools per day, I believe.
Oh, that's right. Okay, so they were looking at... Oh, I see. So the second Nicaragua trial was statistically significant for duration of diarrhea, but not for number of stools per day.
Right.
And then Nepal one, same thing, actually. 0.06 for duration of diarrhea and 0.03 for number of stools per day. So anyway, they're small trials. And she said, let's combine these into a little meta-analysis and see what we can find.
Yeah, good. Yeah, I think that's excellent. Anything else that you want to add about the methods, or you feel like, I mean, I think that's pretty good description.
A few more details. I mean, there were a total of almost 250 kids.
Mm-hmm, yep.
So that's the size, kind of like...
across all 3 studies.
Kind of respectable. Yeah, so the docs doing the homeopathic prescribing was a different set of practitioners at each study site. And one thing, so this was all using that 30C potency, which, as far as we know...
So over Avogadro's number, okay? So if there's an effect, it's due to the homeopathic effects, we can't say it's due to, the fact that there's herbal effects or something like that at that level.
Not as far as we know.
Okay, cool.
Not according to pure math.
Right. And then they had a few other interesting safeguards in there. I thought, like, one concern you sometimes hear is, well, maybe it was adulterated with an active, medication or something, and that's why it worked. And so they did do a random sampling of the pellets and found no difference between them. So they did have some control for adulteration. Like you said, the dilution was quite far down, so we're dealing with these homeopathic effects only in theory. Yeah, I think that was good. You want to roll into the results, and then we can try to critique it a bit?
Okay, yeah. So 230 of the kids completed the full 5-day follow-up period. And looks like, okay, for those patients, there was an 18.5 reduction in the duration of diarrhea from 3.8 days in the placebo group to 3.1 days in the group receiving homeopathy.
Mm-hmm.
And the mean number of stools per day for each patient, and that was p-value of 0.008. So nice and statistically significant. And then the mean number of stools per day for each patient during the entire 5-day treatment period was 2.7 for the treatment group and 3.4 for the placebo group, p-value of 0.004.
Mm-hmm.
So also nicely statistically significant. And then it gets into a bunch of stuff that is kind of over my head, where it's talking about Kaplan-Meier plots and Cox regression analysis. And I was hoping if that stuff seems relevant, you could comment on it.
Yeah, I don't know that the survival analysis is super relevant. I do think that if we keep just sort of like the basic meta analytic results, I think are interesting, and then also just the setup. So let me well, okay, let's start with that. So why don't you start with your thoughts if you want, and then I'll share my thoughts, and we can chat about it.
Well, so if this is a treatment of any random thing, and we're not calling it homeopathy,
Mm-hmm.
it's kind of a slam dunk.
Mm.
It looks like it works. The trial design looks good. The if you look at their conflicts of interest at the end, Boiron, a homeopathy company, did give them a research grant to support the project.
Mm-hmm.
But these are respectable people in academic positions. And so I don't think getting some money to do the trial is enough to make me really worry about a conflict of interest. They're not like on their boards or any kind of conflicts of interest like that. They're not paid by the companies. So I mean, if it's anything but homeopathy, it's a nice trial design and nice statistically significant results. The clinical significance, I guess I would say, is not super amazing. The difference between 2.7 stools and 3.4 over a 5-day period.
Mm-hmm. Mm-hmm.
Or the difference between, what was it, 3.8 days of diarrhea versus 3.1 days.
Mm.
That's not like a, wow, home run. That's really changing people's lives. But really, if this question is, does homeopathy do anything? Looks like it does.
Gotcha. Yeah. Interesting. Yeah, I mean, I think I agree with some of the things that you're saying. Like, I think the conflicts of interest are definitely there. I guess I have more concern about them than you do. So yeah, so it looks like the funding came from a homeopathic company. Like you said, the author of the systematic review, the first author, is also the researcher in these studies.
Yeah.
So there's like definitely personal and professional and belief structure conflicts there, potential conflicts, and or at least like affiliation to one side, I would guess. And so normally I would say I agree with you that you can have those influences and have a fine study, like if you kind of cross all your T's and dot all your I's. And I don't know that they did that. So like I guess I'll take a little bit of a nuanced approach. So I agree, like I think the primary studies were, from what I could tell reading about them in this, I didn't look at the original ones, but they look pretty solid. Like the design is good. It was like quadruple blind. You had this one pharmacist in the US who was like actually knew what was what and everyone else had no clue. You had secondary people following up with the patients. Like, yes, the parents were reporting on their kids' response, but the parents were blinded too, so it shouldn't really matter. And it's really easy to blind homeopathy, so I feel like that blind really stuck. So I don't have any issues with the primary studies. I guess I guess I have issues with this secondary analysis. So like it's a meta-analysis, but it's not a systematic review, which is kind of weird. Like normally you have a systematic review with a meta-analysis, or you have a systematic review without a meta-analysis. Very rarely do you have a meta-analysis without a systematic review.
Mm-hmm.
And basically they're like, hey, we did these 3 studies and there's a lot of similarities, so we think it would be useful to meta-analyze them, so we're going to meta-analyze them. And that's like a totally legitimate position to have. But I guess my concern was, and there's like no that I could see, I don't, maybe you caught it, like no registration, like they didn't register the design for this anywhere either. Speaking of that with the Shang paper,
Mm-hmm. Mm-hmm.
and I didn't think the reporting was very good. Like it wasn't clear how they did their systematic review. I ended up plugging in the raw numbers into R and running it on my end, and I got very similar results. So I don't feel like they're totally misleading. Um, but I guess my concern is if we take these numbers at face value from the primary studies, and even if we meta-analyze them and get a very statistically significant, and I mean, you could even argue that clinically significant result, shave off 3/4 of a day, like maybe that's a big deal. Maybe not. But if we're kind of interested in this, is this homeopathy real thing argument, then we'll take anything, I guess, for that point. Um, so I guess my question is, to the argument of this is all publication bias, right? Then I wonder, I'm concerned that we didn't do a systematic review on this clinical topic, right? Because it could be that these 3 studies indeed did find this, but there's another 3 studies in this population that didn't. And if they were meta-analyzed together, the whole thing would be negative. I think that was my biggest concern, is like I don't know that there isn't other evidence out there that should not have been included in this.
Mm-hmm.
But I agree with you. I think if we just do the straight meta-analysis, you do see this highly significant thing. And just the thing about p-values real quick. So it's so interesting that you're saying that about your dad and physics. We have this like obsession with like 0.05. I just gave a class on this at Sonoran last week where I was like,
Yeah.
it's somewhat random. And like, if you actually talk to statisticians, they're like, why are doctors obsessed with this number? And they wrote like a whole book of responsa about how doctors have just like totally taken it. I mean, it's not unimportant, but it's like taking it too far. So it is like tyranny of a threshold type of thing. But I would say like it is totally legitimate to meta-analyze 3 studies that are like barely significant and have a significant result. That's like one of the major points of a meta-analysis, is to borrow strength across multiple studies. So I have no issue with that whatsoever. But yeah, I guess my biggest concern was the conflicts of interest and the lack of a systematic search.
Yeah, those are my concerns too. I mean, sort of what I appreciate about it being a meta-analysis without a systematic review is that it's really apples to apples.
Right, that's true.
They're like, look, we're one group. We did these same trials the same way.
That's right.
We can just plug and play with our numbers, and there's no like fudging with different outcomes or different times of collecting data, that type of thing. And that was an issue. If I remember correctly, I was looking at Lint's response to Shang,
Uh-huh.
and they were like, "You're comparing such disparate things that it's hard to tell if you are really getting a result worth considering." And with this, you're really comparing the same thing every time.
That's true.
But could there be publication bias? I mean, is there even some sort of bias in this group because they are all doing something the same way? That is a total concern.
Look, the thing is, we don't do this for money. This is pro bono. And quite honestly, the mothership kind of ekes it out every month or so, right? So we do this because we care about this. We think it's important. We think that integrating evidence-based medicine and integrative medicine is essential. And there just aren't other resources out there. The moment we find something that does it better, we'll probably drop it. We're busy folks. But right now, this is what's out there. Unfortunately, that's it. And so we're going to keep on fighting that good fight. And if you believe in that, if you believe in intellectual honesty in the profession and integrative medicine and being an integrative provider and bringing that into the integrative space, please help us. And you can help us by becoming a member on Dr. Journal Club. If you're in need of continuing education credits, take our NANCIAC approved courses. We have ethics courses, pharmacy courses, general courses. Interact with us on social media, listen to the podcast, rate our podcast, tell your friends. These are all ways that you can sort of help support the cause. Yeah, it's interesting. So this was a really interesting paper for a lot of reasons. Like I think I've come across 1 or 2 papers in like 10 years where they do a meta-analysis without a systematic review. And it's the same idea. It's like one clinic or one lab that's done a bunch of similar experiments. And I think like if you think about the theory behind meta-analysis in general, in a situation like that, you would do something called a fixed effects meta-analysis, and you would take out heterogeneity, because you would say that these are essentially the same experiment run 3 times.
Uh-huh.
And um, and I think, like, if we think of, I haven't had to think about this in so long, but if we think about this from like the philosophy almost of meta-analysis, it's almost as if it's one single study that we're now reporting on. And so I wonder if a better way to think about this is, here are 3 small studies, or you can also think about this as one large study, which was statistically significant. And and I think that is probably the better way to think about it, because it doesn't address at all the possibility of, yeah, you can have individual statistically significant studies, but then that may be, random chance, whatever it is. And you need to look at across the literature. So yeah, I wonder about that. And when I ran, they didn't report their heterogeneity, I don't think, but when I ran it in R, there was like zero. It wasn't zero. It was like 52% I squared, which is pretty good. It basically like, no, there was a 0% heterogeneity. So I squared. So essentially, like, it was 3 identical studies. And it turned out that the random effects meta-analysis, which you would normally run, and a fixed effects, which you would run in a situation like this, were identical, because there was like no heterogeneity to consider. So I really think it might just be best thought of as one large study in that way, with just like 3 sites done over time.
Yep. That makes a lot of sense. Yeah. I have another. I don't know how much time we have.
Yeah, we got time.
Okay,
go for it. Hot take.
So I think really, in terms of the meta wars, this kind of doesn't really count as a meta. It just,
well, right, because when we say meta, we mean systematic review with meta-analysis. Yeah, it's just cooler to say meta wars. Yeah, that's right.
yeah. And so even though this is a meta-analysis, and it's got more to look at than the depression one that you looked at last time,
right?
It's not a systematic review and meta-analysis to really battle with Lint et al. And Shang et al.
I think that's fair.
So that takes me back to thinking about kind of the philosophy of it. And you guys have kind of talked about Bayesian statistics a little bit on the podcast. Do you want to tell our listeners, your listeners, what Bayesian statistics is, basically?
Yeah. And this is, I want to tie this back also to your dad in physics and using a different p-value, because I think this is like maybe the crux of what we're talking about, which is a hot take. So the statistics I know is, frequentist statistics. I don't consider myself a Bayesian. And however, so there is formal Bayesian statistics. However, when most normal human beings talk about Bayesian approaches or Bayesian view, what we mean is that we need to consider the prior possibility, the prior likelihood that then gets modified by a new experiment, right? And so normally with frequentists, we don't really do that. We basically assume there's like no previous knowledge, and we do this, we do our experiment, and then we come up with a conclusion. And Bayesian statistics says, no, like, that's dumb. You should consider the previous knowledge, which totally makes sense. And so the argument from like a Bayesian perspective for this is like, if it seems so implausible, then you should have a much higher bar. Now, the frequentists would say, well, this is now an unfair bar type of thing that you're applying. And so that's sort of the debate we've had. Now, can you tell me more about, like, I mean, maybe you know, maybe you don't, like, why with physics is it so low? Is it just that we want to have, well, yeah, tell me your thoughts on that.
Well, I'm certainly not a physicist, so my basic understanding is you're working with so much data that you're going to have unlikely things happen all the time in like particle physics. So you've got to have a really, you've really got to consider things significant only if they happen very, 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 very unfrequently, or the chance of them, the odds of them happening by chance are very, very low, just because you're looking at billions and billions of particles.
Okay.
So
yeah, that makes sense.
That's my basic understanding. But I think I use Bayesian or Bayesian statistics in that more lay sense you're talking about of, let's just consider the priors. So what is your baseline thought? And then how much do you want to modify that?
Yeah.
And as I listen to you and Adam, I think, well, I don't know about you and Adam, but I can say for me, if you're coming to this with a baseline prior of, something with no molecules in it working is so improbable, I would need a lot of evidence to show that it works. And in that case, I'm like, no, the evidence isn't there.
Right.
The evidence is not there.
I think that's fair.
extraordinary claims require extraordinary evidence, and we haven't seen that level of extraordinary evidence. But if you're asking a bit of a different question, which is whatever is in these little white pills, does that work as well as or better than whatever is in these little placebo white pills? I think we don't need extraordinary evidence for that.
Walk me through that again. Hold on.
Well,
Say that again.
I'm just not convinced that there's nothing in there. Is there a memory of water and it's shaped different, or is there some sort of physical force we don't understand? Or I don't claim to know. That mechanism stuff is a little deeper than I can claim. So maybe there's molecules in there, maybe there's not. Maybe water has some sort of memory. I don't think so. But I don't have the hubris to think I know how everything works. We used aspirin for 80 years before we had any idea of what the mechanism of action was. And that didn't mean we needed a higher bar in a randomized controlled trial of aspirin versus placebo. We just didn't know how it worked, and eventually we figured out how it worked. And so there's a world in which homeopathy doesn't exist, where it doesn't do anything. It doesn't work. But there's a potential universe, in my mind, a theoretical universe in which it does work. And in that universe, a randomized controlled trial of homeopathy pills versus placebo pills needs exactly the same level of evidence as aspirin pills versus placebo pills.
I don't know if I understand the difference of what you're saying. So let me see if so you're saying, so if we want to say that there is, on a philosophical level, that there is something there, we need extraordinary evidence, and we're not there yet. If we are not making a philosophical claim, but saying, I don't know, should an insurer pay for, this pellet or something like that, that it would be enough? Is that what's the difference between those two scenarios? I don't know that I'm following that.
Or even just a clinical claim. If we're trying to prove that pellets with no physical substance in them work, we haven't done that. That's too extraordinary of a claim. But I'm just not convinced that we know what's in there, or we can make claims about a mechanism. I'm just whatever this homeopathy stuff is, does it work? And so I come to it with, first I heard about it from my Swedenborgian neighbors. And then I came to ND school, naturopathic medical school, and I heard really smart clinicians. Our homeopathy professor, Will Taylor, one of the most thorough diagnosticians I've ever met. All he did was homeopathy.
Right.
And hearing from these clinicians, oh yeah, I think this works. So I don't know what's in it. I don't know exactly how it works or doesn't work. I can't make claims about the mechanism of action, but I think it helps my patients. So that's the Bayesian in me came from that, from being oh, sounds like clinicians are saying it works. And that's the history of medicine, is the history of professional opinion. And so I feel we're starting from the basic history of medicine. Maybe this herb works, maybe it doesn't. The person who taught me said it does. Maybe they're right, maybe they're wrong. And then assessing that with a randomized control trial, which we've done a lot of in homeopathy.
And that's kind of interesting. So okay, so it's your frame of reference. If it's a philosophical frame of reference, that's one thing. If it's a clinician frame of reference, that's right. Because, and to be fair, okay, so this is exactly what you're saying, but I think it's finally clicking with me. So if you're a clinician and you have a patient in front of you and you want to know to give them a medication, let's say you want to give PPIs for some proton pump inhibitors or something like that, you might be confident enough saying, yeah, there's some randomized controlled trial evidence to support this. It seems reasonable. Let's do it. It's not like you're digging deep on a philosophical level to know at 0.000001 level of p-value that PPIs actually work. You're comfortable enough in a clinical environment to say, yeah, that's enough evidence for me. Is that a fair approximation of what you were trying to those two groupings?
Yeah, I guess I'm just saying that I am comfortable with homeopathy being assessed at the same level as pharmaceuticals, and I don't think it needs a deeper level of scrutiny unless you're insisting on bundling the claim that there's nothing in there with the claim that it works. And I don't care about the claim of whether or not there's something in there. I'm just curious as a clinician about whether it works.
I hear what you're saying. I guess I wonder about that, just to push back a little bit, because the design of a randomized controlled trial has nothing to do with the mechanism, right? It's just if it works or not.
Yeah.
Oh, and that's your point. And then you're saying that we should use the same rules. Whereas if we're trying to make a different type of claim, that's when we would use different thresholds.
Yeah, exactly. Right. Like I'm like,
Okay,
for the 80 years we didn't know about how aspirin worked.
I see.
We still assessed it with the same rules as everything else. And this thing, if it works, we don't know how it works. So we should assess it with the same rules, unless we're trying to make this extraordinary claim that it's working through this method that doesn't have to do with molecules. Like I can imagine a world in which at some point we find out there are molecules involved in homeopathy. We just didn't know how to look at them right.
And it doesn't break our brain. It doesn't break physics as we know it
Doesn't break physics.
to have a mechanism there. You know, yeah, I think that's super. That is interesting. You know, I would say I've definitely softened to it over the years. Like I think, you know, I was like, we were both that student in the back of the room, and I still think the chances that it's real are infinitesimal. But I think I don't know. The longer I've been in practice, like hopefully the less hubris I have, and I just feel like there's recognition that there's so little. There are things that I don't know is more and more, and you know, I think I was. So I wrote this like seventh principle paper about how we should, you know, have a critical evaluation principle in naturopathic medicine. I still believe in that, but we came down really heavy-handed against homeopathy in that paper. And when I think about myself in who I was when I wrote that versus now, I think that I was reacting probably more to like the chip on my shoulder, want to prove this profession more than anything else, you know? I
Mm-hmm.
mean, like I was aware of the literature, but I mean, I think with like with fresh eyes, as you're saying, like from a standard clinical perspective, like the research is there. It's just so hard to believe that it's real. So I don't know. Is it as heavy handed? Should it have been as heavy handed as I had? I don't know. Or at least what was my motivation? I think it was more about I don't know, getting us in a more conventional realm or something like that. I'm not sure.
Yeah, I think a lot of times naturopathic doctors, especially when we're early in practice, we're really afraid to be wrong or to look dumb. And I think requiring more stringent evidence decreases your chance of a type 1 error,
Mm-hmm.
right? It decreases your chance of seeing an effect that isn't there,
Mm-hmm.
but it increases your risk of a type 2 error, of missing an effect that is there.
Right.
And so that's I also don't use homeopathy in my practice. I just don't. It wasn't convincing enough when I was a student for me to make the big effort to study it deeply. And there's so many other things that I use that I feel so confident work well that I use those things instead. But I also don't presume that I know. I don't want to miss effect that's there. And I think really making sure you're so rigorous that you exclude um, you're willing to miss benefit is really important for medicines that maybe are toxic or super expensive or have a big societal burden or something. But for something as safe and cheap as homeopathy, like I'd be more worried to miss benefit that is there than I would be worried to um, uh, accidentally see benefit that is not there.
That's interesting. Yeah, it's so you know, I think the crux of what we're talking about is if we want to zoom out beyond homeopathy per se for a second, is like what is our priors or what is our clinical framework or what is the framework with which we are approaching a question and I think that makes sense and you think about just informed practice anyway you need to frame things within the risk of harm, the risk of benefit, the patient values, and all that. And so we're constantly doing that. And I also think that this study is a good example. Like they did, I'll never forget. I don't know. Well, you went to NUNM, but at Bastyr we had we had a homeopathy debate while I was a student, and Nat Brignall went up against our like chief homeopathy chair. I don't remember who it was, and I think his big argument, I thought it was going to revolve around like meta-analysis stuff. It didn't. His big argument was, you're gonna there could be toxicity in there, But the bigger argument was you're going to miss other treatments. You should be giving other treatments, and you're going to spend time on this bogus stuff, and patients are going to get harmed. And I just remember I thought, even though I was like, a Brignall devotee, I just remember the chair kind of being like, I'm so sorry that happened to you in clinical practice. And that should never have been practiced. And that's a terrible homeopath. And, I that just really stuck with me, is that you can still be a good clinician and keep an eye on things and have, understand when you're no longer comfortable with things progressing. And I think they did a good job with that in this study, where, they basically said, we're going to do homeopathy for a few days. We're going to send I don't know if it was like a clinical personnel or social worker or something out to the houses and make sure that the patient's okay after a few days. We're going to do parasite testing. And
Yep.
if they're not better, we're going to treat them, and we're going to check in on them. Right. So it was like very intentional to not allow for that risk. And I think, like, I don't know what Dr. Brignall's experience was, but yeah, I could see, and I had patients when I was at Bastyr where they were like, I refuse to do conventional medicine. And, I just want to do that. And that was very uncomfortable for me, right? Because it was like, that's clearly their choice. But, that in my belief structure, like, you may be harmed by this, right? So I don't know. I think the harm argument is real, but I don't know that it's required, right? Like, you can be a reasonable person prescribing out there, what to me seems like out there stuff, as long as you're keeping an eye on risk and time, and when do you bail, and when are we being religious about this versus keeping the best eye on the patient, type of thing.
Yeah. Yeah. That all makes sense to me. That, that being said, I still don't use it with patients, even though it's safe. And
Yeah.
I guess I think if it is real,
I can't stomach it. I don't do it. Yeah.
You probably have to pay a lot of attention to it to get a good effect, like the classical homeopaths giving individualized remedies in these 3 studies that were meta-analyzed. And I'm not that. I only have so much time. There's only so much I can do. So I don't give it to patients. But when patients come into me and they say, oh, I'm taking this remedy, I also don't tell them, well, that's bullshit, you should stop, because we really don't know. It's 2023, and I think science still does not have good answers.
Yeah, I think that's kind of where I'm at. Like, I have yet to prescribe a homeopathic, and I never will, probably. It's just not my jam, and I don't feel confident enough in it. But I think, like, as the years progress, I've got less and less judgmental when other clinicians have brought it up and things like that. I think that's probably a fair statement.
Yeah, I will say, zooming out from is there an effect to is it a thing that clinicians could or should use? I mean, there is all the non-specific effects that you've talked about, the lengthy intake, the fact that you're taking something. So I don't use it with patients, but my son does competitive martial arts, and I throw him some arnica sometimes when he comes back all bruised. Is it just a placebo effect? I mean, yeah, maybe it is. But it's not going to hurt him, and I happen to have it on my shelf. So
Yeah.
yeah.
Yeah, no, I know my wife will use it with our kids, and I'm like, I'll just feel like muttering under my breath, and she's like, whatever. And then, it's people get better, regression of the mean or whatever. And she's just like, well, see, here's the proof. And I'm like, a little more complicated than that. But yes, I see this reinforcement that, we get from all medicines, of course. And
Sure.
but you can see how that would absolutely play out.
Yeah.
Okay, cool, man. What else? Anything else we should talk about here?
I think that's it with the study. So basically not systematic review and meta-analysis, but sort of an interesting, large-ish for homeopathy randomized control trial.
Yeah, and I liked your, to the earlier point of we need replication, which, like you said, was it Shang or Lind argued? I guess Lind argued. This is indeed that, right? It's a threefold study being replicated across the board and showing similar effect sets.
There is one other thing.
Yeah.
When I was pulling up all these Jennifer Jacobs papers to, print out this meta-analysis.
Oh, you prepped. Nice.
Oh, yeah. I read the study in advance. I found out, so this meta-analysis was from 2003. There was one more Jennifer Jacobs trial of homeopathy for diarrhea in 2006 in Honduras.
Oh.
And what they did was they took the 5 most commonly used remedies in all of these studies, and they bundled them into one combination thing, and they just gave just that combo to everybody with diarrhea.
So no classical intake or anything like that. Mm-hmm.
No classical intake, nothing like that, but still randomized and still oral rehydration therapy for everybody. And it was like 200 or 250 kids. And what they found was no difference from placebo.
Really? Interesting.
Didn't differentiate at all.
Huh. And how big was the study? How many people?
It was like 200 or 250 kids.
Wow. Interesting.
So what that means, I don't know. I mean, maybe it's a point towards her integrity, that she isn't just trying to prove homeopathy works in every occasion, or maybe.
But that's like, you could take it either way, right? Because like so all these 3 studies was like 230 people. And so like one more negative study, to our point, would negate the effect and say it was a publication bias randomness thing. Or not publication bias, but just sort of random. Well, yeah, I guess publication bias randomness. Or you could say, yeah, but the design was different and it wasn't true classical homeopathy, and that's why it didn't work. And I mean, that's so interesting. That really underlies this issue that like you can argue both sides of this case like ad nauseum, and it's like every study you can come back with some. I mean, look at this. It's like, oh, you need replication studies, and I'm like, well, if we look at 3 replication studies, it's really just one big study, and there's still publication bias, and it's like, and then, yeah. So, and you're like, oh, one more 200-person study, and it negates it all. You're like, yeah, but is it really classical homeopathy? So, man, you can see why I think the lay public, and maybe not just the lay public, gets infuriated with scientists sometimes.
Sure.
Because it's like you can really bring your own biases to the table and kind of argue both sides of it, which is so frustrating, because I feel like the whole point of some of these standardized approaches is to have standardized ways of analyzing it, which, to the homeopath's point, like standardized ways of doing meta-analyses here is somewhat supportive. It's only when you use these unstandardized approaches where it's not. And so it's like, yeah, I don't know. It's challenging.
Okay, so if this wraps up, which it wraps up your homeopathy miniseries.
Well, yeah, but no conclusion. But with no conclusion. More confusion than we started with.
So that's what I wanted to end on, if it's an end. Joshua Goldenberg, what do you think? What do you think all this means? Do you have a conclusion, or just a big question mark?
Oh, that's a good one. I don't know, man. I feel like there is some pretty significant evidence that this is a thing, like just standard clinical evidence. And I feel like to disregard that is like to play on such different level than I do with any other medical study just seems disingenuous and like not really evidence-based. And so I think like there's a difference. There's like my science-based mind and my evidence-based mind, maybe. And my science-based mind is not pleased and convinced, but my evidence-based mind is like, well, this is probably sufficient for people to continue to use, even if I'm not comfortable doing it. I don't know. I'm kind of shocked to be here, but I think that's my honest truth. I'm going to lose like all my EBM friends now. Thanks, man. Thanks for outing me. But I don't know. I mean,
I think what you're doing is you're remaining true to your pre-registered beliefs about the degree to which you believe in science. I admire it. And I'm honestly, maybe I'm just admiring it because I find myself in the exact same place where I'm like, I still don't use homeopathy, or like send my kids to a homeopathic pediatrician, like, but I'll throw some arnica at them. And I think the science says it works. Like what science we have seems to indicate there is something there.
So are we at the, we'll throw some arnica at it stage of acceptance? Is that what we're at?
That should be a whole new phase of acceptance. The official throw some arnica at it phase.
We started with back of the room mumbling to ourselves or louder, and now we're at, throw some arnica at it. How can it hurt? Okay. Fair enough. All right, sir. Well, that was a wonderful. I'm going to get an earful from Adam. He's going to be like, "You said what on air?" So maybe he has plausible deniability. Maybe that's what he thought was going to happen, and he needed plausible deniability. That might be a thing. Yeah. He's very smart in that way. All right. Thanks for joining us.
Thanks for having me.
And thanks, as always, for being such a great listener and sending us articles to read and science to talk about. And we'll see you all next time, listeners. If you enjoy this podcast, chances are that one of your colleagues and friends probably would as well. Please do us a favor and let them know about the podcast. And if you have a little bit of extra time, even just a few seconds, if you could rate us and review us on Apple Podcast or any other distributor, it would be greatly appreciated. It would mean a lot to us and help get the word out to other people that would really enjoy our content. Thank you. Hey, y'all, this is Josh. We talked about some really interesting stuff today. I think one of the things we're going to do that's relevant, there is a course we have on Dr. Journal Club called the EBM Boot Camp that's really meant for clinicians to sort of help them understand how to critically evaluate the literature, et cetera, et cetera. Some of the things that we've been talking about today. Go ahead and check out the show notes link. We're going to link to it directly. I think it might be of interest. Don't forget to follow us on social and interact with us on social media at Dr. Journal Club, Dr. Journal Club on Twitter. We're on Facebook, we're on LinkedIn, et cetera, et cetera. So please reach out to us. We always love to talk to our fans and our listeners. If you have any specific questions you'd like to ask us about research, evidence, being a clinician, et cetera, don't hesitate to ask. And then, of course, if you have any topics that you'd like us to cover on the pod, please let us know as well.
Thank you for listening to the Dr. Journal Club podcast, the show that goes under the hood of evidence-based integrative medicine. We review recent research articles, interview evidence-based medicine thought leaders, and discuss the challenges and opportunities of integrating evidence-based and integrative medicine. Be sure to visit www.drjournalclub.com to learn more.